Recently, you may have noticed something new on your clinical microbiology reports. You're probably used to seeing S's, I's, and R's on a susceptibility report. But how are these determined? An interpretive category S, I, or R for a breakpoint is based on the minimal inhibitory concentration, or MIC, of a specific bug-drug combination. This interpretation is meant to help predict the likelihood of being able to treat an infection, but it is very important to understand that when the lab makes these interpretations, they are based on a very specific dose and route of administration. If a different dose or route is used, then the interpretations have little meaning. If the lab you use adheres to guidelines set by the Clinical Laboratory and Standards Institute, or CLSI, you're likely to start seeing a new category. But what is SDD? Well, SDD is a new interpretive category, and it stands for susceptible-dose dependent. SDD has been used in human medicine since 2014 to provide clarity on when alternative or specific dose or frequency of administration may be required. In 2024, veterinary clinical microbiologists, pharmacologists, and clinicians who serve on the CLSI subcommittee on veterinary antimicrobial susceptibility testing, or VAST, approved the addition of SDD as an interpretive category for MIC breakpoints to help guide veterinarians in appropriate dose selection for the veterinary fluoroquinolone drugs, enrofloxacin and marbofloxacin. This classification will likely be added for other antimicrobial agents in the future. Currently, the SDD breakpoints for enrofloxacin and marbofloxacin are available for infections caused by the common pathogens Staphylococcus, Pseudomonas aeruginosa, and the Enterobacterales, like E. coli and Klebsiella. But what exactly does SDD mean for you as a veterinary clinician? A bacterium with an SDD interpretation based on the MIC value is considered susceptible to an antibiotic if you administer the drug at a higher dose or more frequent dose, resulting in higher serum or urine concentrations than the regimen associated with the susceptible breakpoint. Imagine a dog with aspiration pneumonia caused by the bacterium E. coli. After interpreting the culture result completely and in the context of your patient, you decide to use the drug enrofloxacin. However, enrofloxacin has a wide dosing range of 5 to 20 milligrams per kilogram. In most instances, the S category reflects the lowest dose on an approved label. With the new SDD interpretation, the MIC will help with dose selection within a dosing range. If the MIC for the E. coli is found to be 0.06 micrograms per milliliter, which is the cutoff for the S category, and is based on a standard 5 milligram per kilogram daily dose, any dose within the 5 to 20 milligram per kilogram range would likely be effective. In this case, the interpretive criteria reported would be S, or susceptible, since any labeled dose is predicted to be effective. If the MIC for the E. coli is found to be higher, say at 0.12 micrograms per milliliter, to optimize the likelihood of clinical resolution of the infection, you should dose at or above the middle of the dosing range at 10 milligrams per kilogram. If the MIC for the E. coli is found to be 0.25 micrograms per milliliter, to optimize the likelihood of clinical resolution of the infection, you should dose at the high end of the dosing range, at 20 milligrams per kilogram. Where do you find these doses used to establish SDD breakpoints? Ask your laboratory for the doses that apply to the SDD interpretive category for each antimicrobial agent, or check if they already include them on your report. The dose regimens used to set breakpoints can be found in Appendix E of the VET 01S document, which is available from CLSI. At an MIC greater than or equal to 0.5 micrograms per milliliter, the lab interpretation will be R, as the infection is not expected to be successfully treated using any dose within the established dosing range. But it is now understood that using these old breakpoints might increase the likelihood of emergence of resistance and result in ineffective treatment. For the example of enrofloxacin, it is important to understand that this SDD interpretive category applies only to dogs. It is unsafe to increase the enrofloxacin dose in cats, above 5 milligrams per kilogram, described on the product label. In the near future, additional SDD breakpoints may be available for other antimicrobials in animal species. Hopefully now you have a better understanding of what SDD means in the context of your patient. The CLSI VAST subcommittee finds it critical that we continue to tailor and refine our approach to help guide clinical decisions surrounding antimicrobial use. It is our hope that by continuing to update our breakpoints and interpretive criteria, that we can impact veterinary patients and our world by increasing the likelihood of treatment success and preventing the emergence of antimicrobial resistant bacteria. For more on information needed to successfully interpret antimicrobial susceptibility testing results and reports, CLSI has published a document developed by the VAST Subcommittee for Veterinarians, CLSI Vet 09, which is available for purchase at www.clsi.org.